My name is Namandje Bumpus. I am a pharmacologist who focuses on infectious disease, particularly developing drugs to treat and prevent infectious diseases. And I'm also the director of the Department of Pharmacology and Molecular Sciences at Johns Hopkins University School of Medicine. So over the past many months, we found several variants of SARS-CoV-2 virus, and specifically, there have been a number that have been in the news lately that we've really been thinking about. So variants of viruses are expected. Every virus changes and evolves over time. New variants are expected over time. And sometimes these variants may be detected for longer periods of time than others. There's some variants that we see of viruses, we never really see them again. And there are others that really persist. And this is really normal for viruses. So the variants that are really of interest are the ones that have changes at the spike protein. So the currently authorized vaccines basically deliver to us the genetic instructions to make spike protein so that our bodies know how to respond to spike protein. So we can mount an immune response when we see the virus in real life if we become infected. However, if there are variants that have changes at that spike protein, it then can make it more difficult potentially for our body to target and mount a response against that virus because the spike protein looks a little bit different in structure than the one that we received as part of the vaccine. But the great thing about the mRNA technology that these vaccines use is that it can be nimble. So we can actually deliver the genetic instructions to make some of these variants instead. And there's even discussion of a booster potentially that would be specifically for making our immune system respond to the variant. So this vaccine technology really enables us to specifically address variants as they emerge and to potentially design boosters and other approaches to vaccination that can target these variants. So this is why getting vaccinated and following all of our social distancing measures, masking, hand washing are particularly important. In order for the variants to persist, and in order for more variants to emerge, the virus has to be transmitted. So if we can use everything in our toolkit, the vaccines, our hand washing, our masking, our distancing, staying away from large groups of people, then we're more likely to reduce the transmission of the virus, and then the variants won't be able to persist and variants will be less likely to emerge.